About an Ebola scare here in the Mile High City. Just a few minutes ago, Denver Health Medical Center decided to go ahead and test a patient for the Ebola virus. 7 News reporter Russell Haythorne live outside the hospital right now. Russell, doctors there changing their mind after first saying they were just going to monitor the patient.
Yeah, and this was a collective decision. Sorry for the ambulance right here. This was a collective decision not only from the doctors here at Denver Health, but also the state health department and the CDC to go ahead and test this patient for Ebola. They stated all day long that they would not test for Ebola because he was low risk. But now about 10 minutes ago, as you mentioned, they released a statement saying they were going to test this patient out of an abundance of caution. He's being kept in an isolation room right now here at Denver Health. Here's what happened. The patient returned from an Ebola-stricken country in Africa, was designated as low risk, and was self-monitoring for Ebola for 21 days.
This individual was taking their temperature at home as directed, and when they noticed that they had a temperature elevation, they called the health department and they went from there. So the system worked as it should.
The patient was then transported from Arvada here to Denver Health. Denver Health has been prepared for a situation like this since September with a designated containment room like this one. This patient will not be tested for Ebola, and Dr. Michelle Barron of University Hospital explains why.
The level of panic and the level of concern that would be taken from that would overwhelm the fact that it was not even real. And so you always have to be careful when you're ordering a test. Everybody says, well, why don't you just order it? Well, why order it if it's not indicated? It'd be like doing excess blood work on you because I can, not because it really is meaningful as far as what your health is concerned.
She said testing for no other reason than precaution also creates a personnel issue.
You have to get several people to pack it up. It then has to be transported specifically to the state health department.
So again, that report you just watched on tape was filed before this breaking news. The breaking news in this case coming about 10 minutes ago that the state health department along with Denver Health and the CDC has decided to test this patient for Ebola, and those tests will be processed at a lab overnight. We'll have the results of those for you tomorrow morning, hopefully. The state health department says that this test is being done not because the patient being kept in isolation here at Denver Health has a condition that is deteriorating, but because in the absence of another diagnosis, they're doing this out of an abundance of caution. That's the latest from Denver Health. I'm Russell Haythorne live. Back to you.